Hope everyone's having a good little Tuesday night. Welcome to the live stream. Thanks for joining. We're going to cover some muscle, bone, tendon issues, talk about people's problems, talk about a little bit of orthopedics, talk about some hip and knee replacement. But if you have questions, you could always drop them in the chat. I'll go ahead and answer them. I'm an orthopedic surgeon. I specialize in hip and knee replacement operations. And I work in mostly Washington, D.C. and Maryland. And welcome to the live stream. Thanks for joining in. Excellent. Hey, how's it going? Living life, crazy quick. Thanks for joining. So I'll talk to you a little bit about what I do on a day-to-day basis. So for example, I operate at my surgery center. And tomorrow, hey, what's up, Lee? What's up, Joseph? What's up, G-O-D? Thanks for joining in. Thank you, Charlotte. I appreciate that. My goal is to teach and provide as much information to you guys as I can, so I really enjoy doing that. Dragnark, thank you for joining. Any questions you have, drop them in the chat. I'll go ahead and answer them. From Windsor, Canada, welcome to the live stream. Appreciate it. After sitting for a while, my leg feels weak. A couple things control the weakness feeling in your leg. One is nerves, one is muscles. The nerves actually go to the muscles. Exercising, making sure you get your daily intake in water, nutrition, vitamins, good diet, all that can be really helpful. Is knee ablation really useful? I would say knee ablation we're only doing very rarely in very severe circumstances or kind of the worst cases. If you have chronic pain around the knee and we can't find other solutions of problems. Tony J. Azar from Canada, thank you for joining. Eddie from Lebanon. I'm Lebanese. Harb is Lebanese last name. You probably know that if you're from Lebanon. Thanks for joining in. South Carolina, hey, what's up? Muscular dystrophy, is there anything to improve it? Unfortunately, muscular dystrophy is genetic. It's built into your code. You can try and get your muscles as strong as possible. Sometimes different endocrinologists can recommend things to supplement the muscles, and that can be helpful for you. Let's see, from Niagara Falls. Okay, so you're in New York. Welcome to the live stream. If I do one joint, how long do I have to wait to get the other one done? I have my patients wait at the earliest 4 weeks. It depends how bad the other joint is. If it's terrible, I'll do them 4 weeks apart. If you can wait 3 months, sometimes that's a little bit more for a bigger recovery, but it really depends how bad your joints are. Hello from the USA. Welcome in. Had my joints removed in the foot, all 4 toes, due to bad breaks, so my toes don't bend. So they're fused together. That's unfortunate. Anytime you have any operation, it can always cause issues. If there's no joint there at all and your toes are just free floating, we sometimes call that a non-union. A lot of the times if we do that in the foot, we actually fuse the joints together so that you don't have as much pain. Charlotte, you broke your leg. I'm very sorry to hear that. Did you need an operation to fix it? Will having wrist tendonitis lead to surgery? No, it doesn't always lead to surgery. I will say most of the time tendonitis is a self-limited issue and we can resolve the tendonitis by introducing anti-inflammatory type treatments. Preppy Gamer, it looks like you put a link in. If anyone has x-rays, so another thing that I think I'm going to do, so if anyone has x-rays that they want to send me, we can always discuss them and I can put a picture up on the stream. I don't know if anyone wants to do that, but if someone has pictures of like a broken femur or some hardware they put in, you can either email me the x-rays at matthewharbmd.com or you could put the x-rays in the Discord channel and I could put them up and we could talk about them. I think that'd be pretty cool. If you have arthritis and you have an x-ray of your joint or hip knee, we could do that. How do I wean off Lyrica? It depends on the dosage of Lyrica and what you're on it for. Some people just stop those medications cold turkey, but if you've been on it a long time, that can be kind of hard. Terrible knee pain, but the doctor will not do a replacement because I'm too young, 58. 58 is not too young for a knee replacement. My question would be, are you in the United States? There are a lot of other countries, Australia, Canada, UK, where joint replacements are put off. Here in the United States, 58 is not too young for a knee replacement. If you have severe arthritis, we will replace your joint. Okay, I would get a second opinion then. Where are you? What part of the United States are you in? Would be my next question. And but if you have bad arthritis, you have pain, dysfunction, 58, Ohio. They're busy in Ohio. Hard to say why they're putting you off. I don't have a good answer. If you want to send me your x-rays, you could always do that. I could take a look at them. My age is 40. Not too young. Depends on how severe your arthritis is. 53 years old. Here, another person. Eric says 53, scheduled for November 14th. Alaska. Thanks for joining in from Alaska. Appreciate it. Thanks for all the follows, double taps. Ohio is doing the same with your mom. I don't know what's going on in Ohio. Are they too backed up with surgery? I do have a lot of patients travel for surgery. You could always get a second opinion. 50 is not too young for a joint replacement if it's bone-on-bone arthritis. Why orthopedics? I love fixing people. I had an engineering background before. The good thing about hip and knee replacement is you identify a problem, which is arthritis. Nothing else has worked, and you put a hip and knee replacement in, and you can get the patient better, get them up and walking, getting back to doing the things they want to do. I'm 24. I have chronic neck stiffness and shoulder pain. Scheduled for an MRI. So they'll rule out a rotator cuff tear, a labrum injury, make sure nothing is going wrong in that shoulder. How many RA joints do you replace now with biologics being used a lot? I actually published a study on this, and biologics, although they do alter and modify the disease process, they are not decreasing the amount of joint replacements that are performed. I think part of the reason of that is because we're getting really good at doing hip and knee replacements, meaning the results are very good, and trying to modify or treat a long-term condition like rheumatoid arthritis is not always as successful as putting a joint replacement in and getting people up and moving. So even though we have the DMARDs and the biologic therapies for rheumatoid arthritis, the number of total hip and knees that are going into patients with RA is not decreasing. I have knee pain going up and down stairs. So knee pain going up and down stairs, that kneecap is pulled in. This kneecap right here, it's pulled in very hard to the femur bone. Every time you bend, it gets pulled in. There's a lot of stress on that. We call that an eccentric stress on that muscle on that kneecap. And that pull can really cause a lot of pain. Can you explain an MPFL reconstruction? So MPFL, thank you for the rose, Carlick. That MPFL reconstruction is reconstructing the ligaments. So one of the things is if you have a kneecap that likes to dislocate, meaning it pops out, and so this would be a dislocated kneecap when it slides off to the side. We don't want that. So there's ligaments on the side of your kneecap that actually hold it in place. And so an MPFL reconstruction is actually pulling those ligaments and reattaching those ligaments so that the knee is in the proper kneecap's in the proper location and not sliding over at all. How long do you recommend pre-med for dental appointments after joint replacement? I do for about 2 years is what I do. I give my patients amoxicillin, and I do them about 1 hour before the appointment. So I'm on TikTok and YouTube doing live right now. So on YouTube, Dragnock asks, if an elderly patient has a displaced femoral head and is too frail for a hemi, is it right to say they're less likely to benefit from internal fixation with a cannulated hip screw? So too frail, what would you do instead? So too frail, that's when we're talking about people who are too frail, it basically means you're not going to be able to walk, and you only, like I've treated cancer patients before with severe cancer in their hip. So if they have longer than 6 months to live and they're going to be walking, then, it's a very relative term. I would put a hip replacement in them. So I think a hip replacement is the best shot and best treatment because by getting a hip replacement, you can get up, you can walk right away, you prevent blood clots, pneumonia, bed sores, infections, wound breakdown. I've even put partials or total hips and or partial hip replacements in patients like 106 years old who fell and break the hip. So I think hemi and totals are very good operations, and it's very hard to fall into that too frail category. Basically, if you're too frail, that means you're going to expire in the next 6 months. So how do you diagnose loose ligaments? A couple different tests. One of the ways, we bring the knee out to straight and we test it side to side. Hey, what's up from the Philippines? Welcome to the live stream. So one way we test the knee, we bring it out straight, we bring it side to side. And so testing the ligaments on the side of the knee, if I bring the knee out straight, I examine it by holding onto the femur bone and moving it back and forth. And you can see I'm testing those ligaments. And then the same thing, I bring it down to about 30 degrees of flexion. And the same thing, I test those ligaments to see 30 degrees, does it open on either side, and how stable it is. And that's how we test the ligaments. We can get an MRI to see if there's a complete tear, complete destruction of those ligaments. Welcome from Houston, Texas. Thank you for joining the live stream. I appreciate it. Yeah, Dragon Arc, hopefully that is helpful and gives you a good answer. I have arthritis in my knee joints. The lubricants have been tried. No help on opioids, 12 years, other options. I'm very sorry to hear that. If you're on opioids because you have arthritis in the knee, then you probably need some type of knee replacement operation. If anyone wants to send me their x-rays, I'm happy to bring them up and talk about them. I don't know if you guys have any pictures of your x-rays, but if anyone has like a hip or knee arthritis problem or previous hardware or fracture, send me a picture of your x-rays. You can do it on, you could either do it on my Discord channel, or you could shoot me an email or use my link in bio, and I'll talk about them. How do you take care of a shoulder spur? It depends. Usually a spur is an underlying sign that there's a lot of damage. Can I live alone after total knee replacement? Yes, you can live alone after total knee replacement. I have plenty of patients who do that, who go home the same day. They have a family member usually check in on them for a couple days. If your arm hurts very bad, any advice? I would probably see a doctor and get it worked up. Thank you for the follows. Double taps, appreciate it. Yeah, if you guys have x-rays, imaging, something you want me to look at, drop it in my Discord, and I have my Discord up right now on my laptop. Discord's channel is up. If anyone puts an x-ray in my Discord channel, I will talk about it if you guys want that. It's up to you. You join my Discord from my bio. Dark purple bruising around the bottom of a hamstring. You could have torn your hamstring. You can tear your hamstring from the pelvis attachment or from the knee attachment. Bruising is a sign of damage to the ligaments. Thank you for the heart. I appreciate it. What is a discoid meniscus? So a discoid meniscus is a meniscus that has not formed properly. The normal meniscus is a C-shaped. If we look in here, you can see the meniscus is a C-shaped. When this whole thing is blue, meaning that disc, which is a C-shape, has turned into a complete disc, that's a discoid meniscus. That's not what we want. That's a bad thing. It means it didn't form right. We can do things if you have a discoid meniscus. It's very prone to injury. Let's see what else we got. Criteria for anterior hip replacement, really just a BMI under 40, but that's a general cutoff. I do most of my hip replacements as an anterior. 1 week post-op and SI joint fusion. SI joint fusion, it's a hard surgery to recover from. Hopefully your hip or your SI joint was really bad and they tried everything before doing an SI joint fusion. It's a big procedure. So it may seem like a minimal procedure, but it's hard to recover from. The Discord link in the YouTube description doesn't seem to work. Okay. Let me see what I can do. I think I can pull it up, and I'll have to adjust that because let me see if this one works. So let me see real quick if I can put it in this. All right, I'm going to put it in the chat. Okay, so that's the link. Do you see that one, Dragon? Does that link let you in? That's the invite link. I just put that in the channel. Let me know if that one worked for you. I gained 40 pounds on gabapentin. Very sorry to hear that. Be careful. Yes, gabapentin can have some side effects. It's a neuromodulator medication. It works. I'll have to adjust the one in the live stream description. I apologize for that. Still working on trying to get all these links proper. What causes a doctor to have patients come back with infection? So anytime you have any operation, there's a risk for an infection. The national average for infection is about 0.4% for a hip or knee replacement. For my facility, my surgery center, it's about 0.1%. So you have to imagine, if we operate on a lot of patients, some patients are immunocompromised, some patients have HIV, some patients have severe diabetes, some patients have other immune diseases that make them more prone for infection. So they say if you don't want any complications at all, don't operate, but the infection rate for me is very low. It's about 4 times lower than the national average, and I do everything I can to prevent an infection from a surgery. Can you heal from an avulsion fracture without surgery? Yes, you definitely can. Let's see. It looks like, a couple people have joined in the Discord channel, so Discord is up. If you want me to review your x-ray or you have a medical image or something like that, drop it in the Discord channel, and I'll pull it up and I'll talk about it. We talking hips, knees, everything, all body parts. Welcome to the live stream. Thank you for joining in. Elbow always pops when doing push-ups. My joints pop. My knees pop. My ankles pop. My toes pop. It's not uncommon to have popping. It's part of how your joint is designed. If the tissue around it gets thick, you can hear popping. If it's associated with pain, that's a bigger issue. Thoughts on physical therapy? Physical therapy can be great. Do I see P. acnes? P. acnes is a late infection. P. acnes is very common in the shoulder. Thanks for joining. It looks like a couple people have joined the Discord channel. Great. You just click that thumbs up in that rules box, and then it'll let you into the channel, and then you drop an x-ray or put an image in. You should be able to. Perfect. Reverse total shoulder. Reverse total shoulder can be helpful, especially if you have a rotator cuff tear or severe arthritis in the shoulder. I can go ahead and show you guys. Let's see if I can do this. Severe hip arthritis. So not one of my patients, but this is a x-ray of a patient with severe. Let's see if I can save this image. And I'm going to pull up an image just so I can show you guys what severe arthritis is. So everyone knows. See if that's helpful. Okay, so this is a... Oh, I got my ring light in there. I don't know how to get the ring light out. But if you could see, so the, there we go. We got the ring light out. Okay. So this is a arthritic joint. Arthritic joint has no joint space. This is a normal hip joint. And so everything's reversed, so you can't read the screen. But if you look in this area, you see how you see the nice round ball socket. That's what a ball and socket looks like. When the cartilage, meaning this space, has worn out, you get collapse, meaning your leg actually gets shorter, so you can feel like your extremity is shorter, and then your ball actually turns into a football, and it's oval, and it's no longer a ball and socket joint, which is what we want. And you get these bone spurs, you get this big hump over here, and so basically it's bone-on-bone grinding, meaning that the hip is just grinding over and over, and that becomes very painful, and that's when you end up needing a joint replacement operation. And so that can be very discomforting. What's a Hoffa's fat pad? Hoffa's fat pad is the fat pad in front of the knee. So if we're looking at a knee replacement, right in here lies a fat pad. That's where Hoffa's fat pad is. It can get inflamed. We call that Hoffa's fat pad edema. You can get some inflammation in there, especially if this is affected, your patella tendon. Let's see what else we got. Let me pull up a knee x-ray. So I'll pull up a knee x-ray real quick, and then I'll show you guys what knee arthritis looks like. Let's find a good x-ray for some knee arthritis. Okay, here we go. We got a good picture here. I'm going to pull up this picture real quick for you guys. Try and do it so you guys can see without too much. Got some blueprints in the background. All right, this is a... All right, we'll try and get that ring light out of there. This is an x-ray for a knee. And so the same thing. So cartilage is clear on x-ray. So it shows up like this, where you have a nice open space, and then when you get collapse, you see you have a little bit of open space on the outside of your knee, but your knee is completely collapsed on this inside portion. We call that arthritis because the cartilage, which keeps it open, is clear on x-ray, or what we call radiolucent. We call this part of the bone radio opaque, meaning it's very dense, and depending on how dense it is how your bone quality is on x-ray. And so if this area is sclerotic, which is very white, collapsed down, we know that's arthritis, and that's very painful. Yeah, if you guys have x-ray, you can drop them in my Discord. I will bring them up and talk about them. Harb is Lebanese. Do I ever suggest stem cell therapy? Stem cell therapy will not regrow the cartilage. Unfortunately, it is not that good yet. There's limited literature on it, and so it's very expensive. It can cost $1,500 to $2,000. Let's see. Dr. Harb, what's your specialty? Orthopedics. Yes, I do a lot of hip and knee replacements. Top tier hair genes. I appreciate it. Thank you. I do feel like I got lucky with my hair. Can you improve the cartilage in a knee? So once the cartilage is damaged, it will not grow back to normal cartilage. We can do things to sometimes get what's called fibrocartilage to form. And so that can sometimes grow back, but not real cartilage. So fibrocartilage and scar tissue can form. What's the cure for arthritis in the knees? The cure is a replacement. Thank you for the follows. I appreciate it. Where do I work? I work in Washington, D.C. and Maryland. I do have a lot of patients travel for surgery. I also have people do telemedicine visits. Let's see what would be I'll show you guys a picture of let's do a partial knee replacement. So like I was showing you before with that arthritic knee, we'll go ahead and pull up a partial knee replacement. So partial knee replacement looks like this on x-ray. So this is a partial knee replacement. And you can see this was the pre-op x-ray. The space was open on the lateral side. On the medial side, the inside compartment, it was completely worn out. The lateral side was kept to be about the same, and this area, this inside bone on bone, was completely replaced with this partial knee replacement. So that's a good procedure. The partial knee replacement can preserve your ACL ligament. It can save bone. Not everyone's a candidate, especially if you have too much damage. Can you explain hemiepiphysiodesis? And so that is fusion of part of a growth plate. So if you're a young kid and you have a deformity, they would fuse part of your growth plate, and that would realign the bone. Sometimes we do that if there's a deformity that's developing. You can do partial. You don't have to fuse it completely, or you can fuse it completely. So there's a couple different options there, but it's to realign the joint or leg or whatever growth plate you're trying to treat. So more of a pediatric procedure. Let's see what we got. I had a total knee replacement on my right leg, and my left knee is fused at the knee. I'm very sorry to hear that. A fusion can be very, very difficult, very painful. Even if you have questions on YouTube, I got both chats up, so I have the YouTube chat up too. If you have questions, just drop them in the chat. I will go ahead and get to them. If you want to drop an x-ray for me, put it in my Discord channel. Where can you send my x-rays? You can send your x-rays to my Discord if you want me to talk about them. I can definitely do that. My Discord is my link in my bio. My fellow Lebanese. Yep. Thanks. Appreciate it. Or you can send them to my email, matthewharbmd@gmail.com. But really, the Discord is the best. So just check out my link in the bio. You should be able to click on my link and click on my Discord. Hi, Dr. Harb. I'm a medical student. How did you decide which specialty to do? Orthopedics was the way to go for me. I liked surgical procedures. I had an engineering background. I wanted to get people better, cure people, and so being able to do an operation, fix people, put them back together, that's really helpful. I have bone on bone both knees with severe arthritis. The doctor says I need to get my A1C down. So A1C is a measure of diabetic control. If you have a poor diabetic control, we obviously want to control that to prevent infections. A1C, we like to be low. Below 7.5 is usually my cutoff. Let's see. Knee, we got some bone on bone. What's the best way to fix it? Well, to fix completely would be a replacement. But there's other things we sometimes try, like cortisone injections, gel injections, things like that. Any alternative to knee replacement for osteoarthritis in my 40s? Let's see. Oh, looks like we got someone in. So alternatives would include physical therapy, ice, brace, injection, NSAIDs. An injection could be cortisone or gel. Stem cell or PRP I'm not recommending for that much because it's very expensive. Yeah, cortisone injections help tremendously. They usually do help a lot. This is one of the knee replacements. This is let's see if I can do this. This is a partial knee replacement. So you can see just part of the knee is replaced. We keep your ACL, PCL. Thank you for the rose. I appreciate it. Let's see what else we got. How can I get an opportunity in the lab in high school when I go into medicine? I would go to your local university, say you're very interested in orthopedics or medicine, and you want to work with them in the lab. Hopefully they'll get you on some research projects, things like that. Let's see. Yeah, we got some people. No one's posted any x-rays in the Discord channel, but if you want to, the Discord is up. I'm watching it. If anyone joins in, just drop an x-ray. If you drop an x-ray in the channel, I'll go ahead and bring it up and discuss it. Where am I located? I'm located in Washington, D.C. in Maryland. I do telemedicine visits. I do have people travel for surgery. You can go to my link in my bio for all my demographic and detail information. Cervical x-ray? Sure, I can go through a cervical x-ray. So, worst, G-gen, cervical x-ray. Let's see if I can pull up a cervical x-ray real quick. So, how your cervical spine should look. Let's see. I'll just show you a bad one, and a comparison with an MRI and an X-ray for a cervical spine. So I'll go over this for you guys. So, okay, let's do this. So this is a cervical spine. Number one, the cervical spine is, you have a reverse of the curvature. So you can see how it's S-shaped. That's not what you want for your neck. You can see over here, if you have a shape like this, there's usually some impingement on the spinal cord or the nerves. And so if an MRI is obtained, the gray in the middle, this is your spinal cord. This is your front. This is your back. You can see the white. The white is the fluid around the spinal cord in the neck. And you can see this. This is a disc that's pushing. You see there's no fluid. We get fluid, then loss of fluid. This looks like a C. I'm reading MRIs backwards from my phone on my computer screen, so forgive me if I mess this up. But so see 3, 4, 5. So this is a 4-5 herniation, and you can see the black is just pushing on the spinal cord. So that would give you numbness in a certain distribution. It would give you weakness in a certain distribution. Do I have a watch? I have a watch. I don't wear watches or jewelry very much, just because I'm scrubbing into the operating room and scrubbing into surgeries a lot. But I don't do spinal surgeries. My partners do that. I do a lot of hip and knee replacement. What watch do I have? Nothing too fancy. I think I have a Citizen, like Atomic. Nothing too fancy. But I don't really ever wear watches unless it's like a very special occasion. How do I upload an x-ray? So if you're in the Discord channel and you want to upload an x-ray, basically you go to the plus sign at the bottom. Here, I'll show you real quick. So if you go to rules, you hit the thumbs up in the rules, then you hit the plus sign at the bottom and you click upload a file. So if you're in the Discord channel, see this little plus in the lower corner. So you'll enter into the rules. You got to hit the little thumbs up so it knows you're not a robot, and then you go to general and then you click this little plus button, and then it'll let you upload an x-ray as an image into the chat. What's the Discord channel? The Discord is in my link in my bio. If you throw an x-ray in the Discord channel, here I'll put in a note, toss up your x-rays, and I'll talk about on live stream. So if you're in the Discord channel and you toss up an x-ray, I can easily discuss it. So just upload your file there. And no one's done it yet, but if someone does, then I'll go ahead and talk about it. Hey, doctor, why would my right knee replacement be done already? I had it done in 2012. What do you mean done? So did it come loose? Did the parts wear out? What's going on with the knee replacement would be my questions. Is it infected? Was there an issue with it mechanically? If it's bad, then, oh, look, we got our first x-ray. Okay, check this out. Okay, let me see if I can blow these up. So I'm not going to say your name. I'll try to blur out any. Let me let me save this image to my desktop, and then I'm going to just crop it real quick so that no one can see anything. Tools, crop. Okay, so we got our first x-ray in the Discord channel. If you want to type what's going on. So this looks like, so if you look at this middle image, this is a hip replacement. So I'll talk about this a little bit. So this is a hip replacement. This is what we call a fit and fill type stem. It's in good position. So things you want with a hip replacement is you want the okay. Yep, those are mine. So perfect. 3 weeks post-op. Oh, looking good. So this is like what we call a fit and fill stem. So this is looking really good. Whoever did this is probably they're probably fellowship trained. You want the stem to be right in line with the canal, so very, very good. The stem grows, this one's a fit and fill, so it'll actually grow all the way up and down the canal. The cup, so when you look at the cup, a couple different things. You want to restore the offset of the hip. I can't see your other hip, but this looks pretty good for, female. Cup's in a good position. You want it about 45 degrees this way, so that's really good. And then the tilt of the cup looks really good, so we call that anaversion. So anaversion's really good. They got it deep in the bone, so they got it all the way out over to the medial wall, so we want that. They use an extra screw for fixation, so the extra screw adds in some support. I can't see your other side, meaning you need, in order to measure leg length on the x-ray, we need to see the other hip. And so I can't see the other hip on your x-ray, but as far as the position of this goes, for leg length, I do a couple things during my operation to make sure the legs are equal. The first thing I do is I use an intraoperative x-ray. I also do a preoperative templating, so I do preoperative templating ahead of time to get your leg lengths and make sure I try and even it out. And some people, everyone's a little bit different, but let's see, it looks like we got our next x-ray as well. So, if you have an x-ray, you can drop it in the Discord channel. You hit the little plus button at the bottom. You have to do the thumbs up in the rules, put it in general. But if you drop your x-ray, I'll go ahead and talk about it. So let's see who we got here. This looks like another x-ray. Let me try and save this picture. Please tell me what you think. Okay. So here's the picture. Let's see. So hopefully everyone can see that. We got a nice little picture. That's double knees. So this is what we call a bow-legged deformity, meaning that both of the knees are pointed in, so the inside parts of the knee are worn out. And if the inside parts of the knee are worn out, this can be very painful. You can see like what we talked about earlier where the inside bone is rubbing. So for this, this is kind of routine treatment of arthritis. We try to do things like anti-inflammatories. We try to do things like conservative treatment with ice, therapy, bracing, but none of this is going to restore the cartilage. So you could try injections, meaning you could get a gel injection, you could get a cortisone injection, but at the end of the day, in order to actually correct the bow-leggedness, then we would do a knee replacement. So one of the things is, let's see what I got. Let me grab my knee replacement model. I always feel like every time I grab something off the shelf, something's gonna fall on my head. But so one of the things is, if you see the x-ray here and the knee is like this in a knocked knee position, you can see how much stress is on the ligament over here and that the MCL is kind of attenuated down and very contracted. So what we would do is, when we do the replacement, it's a cap. It's basically a cap on the end of the bone, much like you're capping a tooth. Then your knee is straight. So it goes from a position of being in this bow-legged position to being straight. So we straighten the knee out after as well. And so that's part of the correction. So for this, I would say severe arthritis, likely, if injections aren't helpful, then knee replacement, and this looks pretty bad. Looks like you've had it for a while. Bone quality also looks like you're losing a little bone quality, maybe some osteoporosis. Can you show me your watch? I don't have any fancy watches to show you. I have a very basic watch collection. I'm not big on, I don't drive a super fancy car. I don't have super fancy watches. Those things the material things aren't as that important to me. I'm much more on, an experience or a trip, or doing something along that line. So I don't have a lot of those fancy things. I need a hip replacement, but I have to lose 50 pounds. Will the bike do more damage? No, the bike will not do more damage. All right, let's see what else we got. We got another x-ray. Okay, we got the full so here you go. So I guess I can just slide that over. That's not that bad. Let me do this. So you can see the legs are a little bit, like you said before, there's a little bit of a discrepancy with leg length. So I don't have a ruler, but let me see if I do have a ruler. Okay, I'm going to take these surgical scissors right here, and I'm going to use them to draw a line. So basically, if you draw a line across the bottom of the pelvis, and we look at this point and this point, what you can see is that the line is that this point is lower down than this point. So you can see, like you said, that side is a little bit longer. I wish I had a way to, let me see if I can draw on this. Actually, you know what I'm going to do? I'm going to do a quick little template. I template all my hips. So I'm going to do a little bit of templating on the x-ray that you just sent over. And I'll show you, you say you feel like about an inch longer. So I'm going to, so I'm gonna draw on this x-ray that you sent over in the Discord chat, and I will show you what exactly you're feeling and why you feel a little bit longer. So let me just do a little line drawing. So here we go. We got some lines here. So what you're gonna see with this purple line is, this is how we look at leg length. Okay, here's the purple line, and you can see when I draw this out that you're just a little bit longer on this side. So it's not that much. It maybe looks like 3-4 millimeters, and there may be a couple different reasons. The hip may have been unstable, so you don't want an unstable hip, but you want the hip to not dislocate very easily. So you may add a little bit of length. When you have arthritis, your hip actually shrinks a little bit. Many people also, when their hip is restored to the functional position, they may feel a little bit longer. I would give yourself a year. I wouldn't use any shoe lifts. Your pelvis and everything and your muscles around will usually adjust to this. And then at some point you may actually need the other side done, and if it's still an issue, you could add some length to the other side. But I would not wear a shoe lift. This will probably work itself out. There's no need for revision surgery or anything like that. They probably made it a little bit longer to give you more stability in that hip, and many people rehab just fine. 3-4 millimeter discrepancies are not that big of an issue long term. So I know it's a lot to think about. You want everything to go perfect in your recovery. I will say this is kind of the least of it. This is very minimal. Many people have this. It's probably for a stable hip. At a year, I would be very unlikely if you notice it. Dr. Matt, how long have you been practicing medicine? So I've been doing joint replacements. I've been in practice almost 3 years. I've did a year of fellowship, and then I did 5 years of residency. So I've been putting hip and knee replacements in for like about 9 years now. How can I tell if you need surgery for adult scoliosis? A lot of the times we're not doing surgery for adult scoliosis. Let's see, if you have any x-rays, you can always drop them in the Discord channel. I can bring them up and talk about them. Let me check the Discord, see if anyone else has dropped any other x-rays. What's your experience in terms of chondromalacia patella? So that's wearing and thinning of the lining on the back of the kneecap. That can be very painful, and sometimes you can work on quad, hamstring strengthening to get that better. Thank you. I really appreciate you guys dropping those images in the chat. I really want the Discord to be like a medical community where we can talk about orthopedic stuff. People can crowdsource information, but it's very just kind of chit-chatty right now, which I think is good. We'll probably get some other specialists on there. Do I take call at the hospital? I do take trauma call at a level 2 trauma center. Why do boys get skiffy? Boys get skiffy because they have metabolic disease, bone disease, or they're overweight are the most common reasons. As a practicing EMT and a majoring in pre-med. Oh, okay. Do you have any suggestions in which I should study in my free time? I would not study in your free time. I would work on improving your resume. That includes getting things like research or working for a university department trying to get research papers. Have you gone over hip bursitis? Can you please explain? Sure, I would love to explain hip bursitis. Let me pull up a good little graphic so I can get you a good image of what hip bursitis looks like. Let's see, here we go. I'm going to save this image real quick and I'm going to talk to you about hip bursitis. So hip bursitis is inflammation of the bursa, which is on the side of the hip. And the bursa is surrounded by muscles. So this is a pelvis, and you can see these are your muscles. These are your abductor muscles. They come into the pelvis bone. They allow you to level your pelvis. They allow you to get up from a seated position. If the bursa is very inflamed, you get this pain. You can see the muscles and tendons actually insert on the bone on top of the bursa. So this gets very painful with overuse type injuries. And a lot of the times we'll do cortisone injections if that's the case for severe bursitis. I have patella tracking syndrome. Can you talk about a fix for it? Depends how severe your patella is maltracking. If it's way off to the side, we could do things like an MPFL reconstruction or a tibial tubercle osteotomy if it's dislocating. Most of the time, just for like patellofemoral syndrome, we'll do things like braces, sometimes an injection, sometimes anti-inflammatory medications. Let's see. Can you explain why a second hip replacement recovery is more difficult than the first? I will say that no two joints are ever the same. I will say if a patient has a slow recovery from one, they sometimes have a fast recovery from the other one. Sometimes they have fast recoveries from both. That's a perfect world. But no hip is ever the same. Even though you have two of them, they are different. What area of orthopedic research do you think needs attention? I think the big thing we're doing in orthopedic research is looking at ambulatory surgery centers and performing more outpatient total joint replacements. Conservative treatment usually for tracking disorders. I can't recover from the COVID vaccine. I'm very sorry to hear that. I don't know what happened to you. It may be helpful to see a specialist if you're having issues. I do, anytime you get any injection, you can get muscle aches. It's not uncommon, but they should go away. What can they do since you fractured both shoulders 2 years ago and you still have pain? If the bone's healed improperly, you could do a revision surgery to get them to heal. What is the best way to deal with spinal stenosis? Usually conservative treatment like anti-inflammatories, exercises, weight loss. If none of that works, then there is a surgical procedure to open up the spinal stenosis. I've had let me get this comment. I had 7 knee replacements. I'm 50 years old. Test for OI come back inconclusive. So it sounds like you're having repetitive fractures. I would probably see an endocrinologist, get worked up for severe osteoporosis, osteogenesis imperfecta, vitamin D, thyroid, parathyroid hormone levels. Make sure all those are okay. DEXA scan. Hard to say what's going on. It's a very interesting. Usually if you have 7 knee replacements, that's very uncommon. Do you recommend physical therapy for kids with the inversion, femoral, and tibial rotation issues? A lot of the times, kids are very plastic and rubber. They bounce right back and kind of do what they want to do. So they're going to figure out how to walk the best way they can by themselves. If they're having trouble walking or trouble with muscles, then physical therapy can be helpful. Year after my ACL reconstruction, still sore after running a 5K. Hard to say. An ACL, it's a very robust ligament in your knee. You're trying to get it to heal. Depends what graft they used and other things like that. Can a person with knee arthritis be running for exercise? Yes. No contraindications for that. I do have some runners who I do give knee replacements to. How long should I wait until I have my knee replacement surgery? Injured in 2015. If you have severe arthritis and you have disability or problem or worsening function, then you could go ahead for a knee replacement. Those are my two criteria. But thanks for logging on. My Discord is available. I'm still available in that chat. So if you guys ever want to drop any x-rays, I can always talk about them or respond. But thanks for joining in. I hope you guys have a great night, and we'll do more of these live streams. So appreciate all the support for the channel.